Check on the situation at the Philippine General Hospital, and we speak to its spokesperson, Dr. Jonas del Rosario. Good morning, Dr. Jonas. Thanks for joining us again here on Newday.
Good morning, Ria. Thank you for having me.
Doctor, could you give us a rundown of the situation at PGH right now in terms of occupancy rate? Has it eased?
Well, we haven't really made any dent, unfortunately. We are still about 90% occupied. The last number was 226 out of the 250 beds that we have. At least we're not going overboard. Our emergency room is still teaming up with patients, and our ICUs are always full.
So the ICUs are still full. The Trade Department says that they are thinking, or at least would like to ease quarantine restrictions 2 weeks from now. At the rate things are going, do you think that would be a prudent thing to do?
If we're talking about 2 weeks from now, probably they can. We're hoping, the number that we always seem to use right now in PGH is 200. We have not gone back below that. We've been over 200 for more than a month now. So I think that's probably a good barometer. We're hoping that there will be a downward trend, seeing that they seem to be less and less people getting infected, just based on the DOH reports. But at least in PGH, we have not really seen a big difference.
All right, so you are maintaining it. I think that's the problem. Ever since we went into ECQ, it's the number is plateauing, but it's not really going down, right? I want to talk about your healthcare workers over at PGH. What is your manpower like there now? Do you still have any hospital workers who are suffering from COVID or need to be in quarantine?
We just have a few compared to what we had the past few weeks. They pretty much have gone back to work. Every now and then we get 1 or 2 healthcare workers who got COVID, but at least it's not significant enough to affect our number of healthcare workers working in the COVID wards. The other thing that we did, Ria, is we closed a few non-COVID wards, and so we got some of the nurses and doctors to go to the COVID operations. We're hoping that if the numbers started going down, then we can reopen some of our non-COVID operations. But now we cannot afford it now.
Right. So you mentioned you're always at least you have 200 COVID beds occupied. The ICU is full. Your ER is busy. Would you say PGH is overwhelmed, or you guys are managing right now?
I think we're managing okay because we have made adjustments. It's a big thing that most of the hospitals do coordinate their transfers. We also have a way now of trying to keep the asymptomatic, mild, and even the moderates not to go to PGH right away. So we have developed a program, we call it Telegabay program, wherein we assist some of our kababayans to treat COVID-19 at home if they can.
All right, that would certainly help keep your hospital running a bit more smoothly. Thank you so much for your time this morning, PGH spokesperson Dr. Jonas del Rosario. We always appreciate you here.